Recently, some parents have told me that their ears were made too thick. Why didn't I make them thinner? To be honest, many years ago, I spent 1 or 2 years making ears very thin. Using the full wrap technique, you can really make very thin ears. However, if the ear is too thin, the internal support structure is rigid. It becomes more susceptible to damage, and titanium wires can become exposed. It also doesn't look as aesthetically pleasing. So over the years, I've slightly adjusted the thickness to be a bit more substantial. This is because we want the ear, once finished, to look good while also preventing the patient from worrying. The patient should forget that the ear is artificial and live a normal life just like everyone else, not living in constant fear that the ear might get damaged. In fact, when the skin is too thin, there is an issue with cartilage absorption. So, in this regard, those who initially worked with full wrap techniques were especially focused on making the ear very thin. It looked great during the surgery, but a few years later, the problem started to appear. This is why a doctor must have enough experience to judge whether a technique is good or not. So some doctors who transition from half wrap or other methods to full wrap techniques must learn from past mistakes.